Okay, Christine, what are we doing today?
What we're going to do today is we're going to make sure that our glucometer is working properly before we go and inject our patients. So the first thing that we want to do is we want to make sure you can get, pretty much every clinic is going to have your little contact lens cases in there, and you can go ahead and get one of those. And you should have some control solution. The control solution is good for 90 days after opening up. You get one of those out. And again, every clinic should have this. And you should also have your test strips. So when you get your glucometer out, you're just going to have your basic, this is the screen that you're going to show. You do not press any buttons at all. Next thing you want to do is you want to make sure when you look at your test strips that the expiration date, that they haven't expired. So you want to make sure they're good. Mm-hmm. Also, with the test solution, it only goes in the normal range. So when you do the test solution, it should read in between what is given on the two.
So this one is 113 to 171.
Correct.
Okay.
All right, so what you're going to do is you're going to take out the test. And again, this is to check to make sure before you stick your patient. So you're going to put the test strip in with the notch in, and then you're going to put it right there. And as you can see, it's accepting it. And then you should see this little horizontal bar with a little drop there saying it's ready to go.
Ready to suck up blood or something, okay.
And if you notice there's a little square there, and that square, once you put the solution in, it's going to turn blue.
Yes.
And it's going to beep. That's when you know your monitor is working properly. So what you do is they want you to shake. I'll open up both these. They want you to shake the test solution. Discard the first drop. That's why we're putting it on that, and then you're going to use the other drops for this one. Then they want you to take the glucometer and do it in a vertical position and place in there. And it should beep. Once it beeps, it's going to calculate what the...
So it's 131.
So that is within the range of what they expected.
Yes,
okay, now you're ready to test your patient.
So it's working.
So it's working.
So don't touch any button on them.
Do not touch any buttons on them.
And the control solution is good for 30 days, you said?
No, it's good for 90 days.
90 days, okay.
Yes, and then the front office staff should be able to, once it should be discarded. Obviously, when you open up, you're going to mark when you opened up the solution, whomever opens it up, and then it's going to be discarded 3 months afterwards, and then we'll have new solution by that.
So how often you need to check the control solution?
You know, to me, it depends. I would, if you're not sure about it, or if, however your attending is requiring you before you go test your patient, if they want you to do the test solution first, I would do that first. Or if you test yourself first to see what your blood sugar is, then if it's not working, or if it's looking unusual, then I would suggest to do the test solution.
Okay, great.
Yeah.
Thank you.